Please see important safety information and indication at 543.
It wasn't always like this.
It almost turned into a family inside joke.
We came together and figured it out.
We wanted the absolute best for Kyle and the girls.
Wait. Where's Kyle?
We already had two beautiful daughters, Jessica and Kaylee, keeping us on our toes, and we were welcoming our son into the mix. It was an exciting time.
About a year after Kyle was born, as we were getting ready for Jessica's 5th birthday party, my brother noticed Kyle having what looked like involuntary eye movements. We took him to the ER, and after several days in 2 different hospitals, he was diagnosed with infantile spasms.
It was tough news to take. He'd been developing typically up to that point, and that's when the roller coaster ride began. We had 2 other kids, so life had to go on. We just didn't know what that would look like. We're veterans now. Kyle's 20. It's been a wild ride.
The seizures progressed with time, and they became more intense. Having multiple seizures a day impacted every aspect of his life, and in turn, our family's life.
Kaylee and I were so young. When Kyle would have a seizure, it was a little scary, but even then, Mom and Dad really worked hard to make sure we knew what to do.
Kyle is nonverbal. We tried behavioral therapy for years, but many factors, including his seizures, stood in the way of any meaningful progress. So, we all learned his language.
He communicates with his body, mainly with his eyes, but he also leads us to the things he needs or wants. We've all become very fluent in Kyle. In many ways, Kyle was just like any ordinary kid. He was rambunctious. He loved to run, climb. He was full of energy.
But his circumstances were anything but ordinary. It's hard for people to understand what life is like. It's not just the seizures. It's that you can't trust the absence of seizures because their timing is unpredictable. You can never relax.
Where's Kyle became our mantra. We all needed to know the answer to that question at any given moment to keep him safe. We all had to participate.
Our youngest daughter, Jenna, is 18 months younger than Kyle, and like Jessica and Kaylee, she knew her role from the beginning. We can laugh now, but her first words were, "Get down, Kyle." His sisters have been his friends, his advocates, and his caregivers. Each one of them has been in a life-saving situation with their brother. Those are tough moments.
We'd move heaven and earth for all our children, trying to never sacrifice one over the other and doing our best to keep things positive.
Mom and Dad made sure we had fun along the way. They made it their mission that no matter what was happening with Kyle's care, they would balance it out with fun.
During hospital stays for Kyle's treatments or surgeries, we'd go to museums, parks, or bring fun treats into his room and hang out. Those times are some of my favorite memories.
We did everything as a family. Sometimes we had to divide and conquer or change plans midstream, but we really learned how to make the best out of any situation.
It was a lot of responsibility and more challenging than maybe what some of my peers went through at my age, but it was our normal.
Our journey looking for the right treatment for Kyle took us from California to Texas and finally to Atlanta, where we met our neurologist, Dr. Seiden, who introduced us to XCOPRI when Kyle was 18.
With XCOPRI, Kyle is experiencing reduced seizures. This is huge. It's an amazing feeling to see him more alert and expressing himself to us more.
There's a level of peace in the house that we haven't felt as a family in a really long time.
Kyle still has seizures, but they're less frequent than before he started taking XCOPRI.
We're so happy to see Kyle continue to come into his own.
He started playing baseball for the Miracle League in the last year.
Having fewer seizures means it's his turn to be on the field.
Kyle's a fighter. He never gives up.
He's made his sisters fighters too.
Mom and Dad are definitely fighters as well.
He's taught us about being resilient and authentic.
He's taught us how to love others without expecting anything in return.
Do we still worry? Of course. But for the first time, "Where's Kyle?" has become "Here's Kyle."
Important safety information and indication for XCOPRI, cenobamate tablets, CV. Do not take XCOPRI if you are allergic to cenobamate or any of the other ingredients in XCOPRI. Have a genetic problem called familial short QT syndrome that affects the electrical system of the heart. XCOPRI can cause serious side effects including allergic reactions. XCOPRI can cause serious or life-threatening skin rash or other serious allergic reactions which may affect organs and other parts of your body like the liver or blood cells. You may or may not have a rash with these types of reactions. Call your healthcare provider right away and go to the nearest emergency room if you have any of the following: swelling of your face, eyes, lips, or tongue, trouble swallowing or breathing, a skin rash, hives, fever, swollen glands, or sore throat that does not go away or comes and goes, painful sores in the mouth or around your eyes, yellowing of your skin or eyes, unusual bruising or bleeding, severe fatigue or weakness, severe muscle pain, frequent infections, or infections that do not go away. Take XCOPRI exactly as your healthcare provider tells you to take it. It is very important to increase your dose of XCOPRI slowly, as instructed by your healthcare provider. QT shortening. XCOPRI may cause problems with the electrical system of the heart. QT shortening. Call your healthcare provider if you have symptoms of QT shortening, including fast heartbeat, heart palpitations that last a long time, or fainting. Suicidal behavior and ideation. Anti-epileptic drugs, including XCOPRI, may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you have any of the following symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, attempting to commit suicide, new or worse depression, anxiety, or irritability, feeling agitated or restless, panic attacks, trouble sleeping, insomnia, acting aggressive, being angry or violent, acting on dangerous impulses, an extreme increase in activity and talking, mania, or other unusual changes in behavior or mood. Liver problems. XCOPRI may cause liver problems. Your healthcare provider will do blood tests to check your liver before you start XCOPRI and while you take XCOPRI if needed. Tell your healthcare provider right away if you have any symptoms of liver problems, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, or feeling tired or weak. Nervous system problems. XCOPRI may cause problems that affect your nervous system. Symptoms of nervous system problems include dizziness, trouble walking or with coordination, feeling sleepy and tired, trouble concentrating, remembering, and thinking clearly, and vision problems. Do not drive, operate heavy machinery, or do other dangerous activities until you know how XCOPRI affects you. Do not drink alcohol or take other medicines that can make you sleepy or dizzy while taking XCOPRI without first talking to your healthcare provider. Discontinuation. Do not stop taking XCOPRI without first talking to your healthcare provider. Stopping XCOPRI suddenly can cause serious problems. Stopping seizure medicine suddenly in a patient who has epilepsy can cause seizures that will not stop. Status epilepticus. Drug interactions. XCOPRI may affect the way other medicines work, and other medicines may affect how XCOPRI works. Do not start or stop other medicines without talking to your healthcare provider. Tell healthcare providers about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Pregnancy and lactation. XCOPRI may cause your birth control medicine to be less effective. Talk to your healthcare provider about the best birth control method to use. Talk to your healthcare provider if you are pregnant or plan to become pregnant. It is not known if XCOPRI will harm your unborn baby. Tell your healthcare provider right away if you become pregnant while taking XCOPRI. You and your healthcare provider will decide if you should take XCOPRI while you are pregnant. If you become pregnant while taking XCOPRI, talk to your healthcare provider about registering with the North American Anti-Epileptic Drug (NAAED) Pregnancy Registry. The purpose of this registry is to collect information about the safety of anti-epileptic medicine during pregnancy. You can enroll in this registry by calling 1-888-233-2334 or go to www.aedpregnancyregistry.org. Talk to your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if XCOPRI passes into breast milk. Talk to your healthcare provider about the best way to feed your baby while taking XCOPRI. Common side effects. The most common side effects in patients taking XCOPRI include dizziness, sleepiness, headache, double vision, and feeling tired. These are not all the possible side effects of XCOPRI. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. Drug abuse. XCOPRI is a federally controlled substance, CV, because it can be abused or lead to dependence. Keep XCOPRI in a safe place to prevent misuse and abuse. Selling or giving away XCOPRI may harm others and is against the law. Indication. XCOPRI is a prescription medicine used to treat partial-onset seizures in adults. Please see additional patient information in the medication guide. This information does not take the place of talking with your healthcare provider about your condition or your treatment. Please see full prescribing information and medication guide.